Welcome to my YouTube channel. Today we will discuss dengue fever. Dengue fever is a painful, debilitating mosquito-borne disease caused by any one of the four closely related dengue viruses. Dengue fever is transmitted by the bite of an Aedes mosquito infected with the dengue virus. The mosquito becomes infected when it bites a person with dengue virus in their blood. It can't be spread directly from one person to another person. Epidemiology of the dengue virus. It occurs in tropical and subtropical areas of the world. Dengue fever is primarily found in the regions with warm climates and high humidity. These areas provide a suitable environment for the Aedes mosquito, which is responsible for transmitting the dengue virus. Millions of the cases of dengue infection occur worldwide each year. Dengue fever is a significant global health concern with millions of people being infected annually. This highlights the widespread impact and high incidence of disease across various countries and regions. Dengue fever is most common in Southeast Asia and Western Pacific Islands. The highest number of dengue cases is typically reported in Southeast Asia and Western Pacific Islands. These areas have a combination of favorable climate conditions and high population density, creating an ideal environment for the spread of dengue. The disease has been increasing rapidly in Latin America and Caribbean. In recent years, there has been notable rise in the dengue fever cases in Latin America and Caribbean. This indicates a shifting pattern of the disease with its increasing prevalence in previously less affected regions. Symptoms. Many people, especially children and teens, may experience no signs or symptoms during mild cases of dengue fever. It is possible for individuals, particularly children and teenagers, to have mild cases of dengue fever without exhibiting any noticeable signs and symptoms. This can make it difficult to diagnose the disease in such cases. When symptoms do occur, they usually begin 4 to 7 days after an infected mosquito bites. Following an infected mosquito bite, the symptoms of dengue fever typically appear within a range of 4 to 7 days. This is known as the incubation period, during which the virus replicates within the body. When symptoms manifest, one of the key features of dengue virus is a high fever reaching temperatures around 104 degree Fahrenheit. Additionally, a diagnosis of dengue fever requires the presence of at least two of the following symptoms. Headache. Individuals with the dengue fever may experience persistent or severe headaches, muscle, bone, and joint pain. Dengue fever often causes intense pain in the muscles, bones, and joints, leading to discomfort or mobility issues. Nausea. Many people with dengue fever experience feelings of nausea, which can be accompanied by a loss of appetite. Vomiting. In some cases, dengue fever can lead to vomiting, which can further contribute to dehydration. Pain behind the eyes. Dengue fever may cause discomfort and pain behind the eyes, commonly referred to as retroorbital pain. Swollen glands. Swelling of lymph nodes or glands can occur as a result of dengue fever. Rash. Some individuals with dengue fever may develop a characteristic rash, typically appearing 2 to 5 days after the onset of fever. The majority of the individuals who contract dengue fever experience a relatively mild illness and are able to recover within approximately 1 week. During this time, the body's immune system fights off the virus and resolves the infection. In some cases, symptoms worsen and can become life-threatening. While most cases of the dengue fever are mild, there is a risk of symptoms worsening in certain individuals, leading to potentially life-threatening complications. It is important to closely monitor individuals with dengue fever to identify any signs of deterioration. Blood vessels often become damaged and leaky. One of the complications that can occur in severe dengue virus is damage to blood vessels. The virus can affect the integrity of the blood vessels, causing them to become leaky. This can lead to a condition known as plasma leakage, where fluid from the bloodstream leaks into the surrounding tissues. The number of clot-forming cells, platelets, in the bloodstream drops. Another characteristic of severe dengue fever is a decrease in the number of platelets in the blood. Platelets are responsible for blood clotting, and their reduction can result in an increased risk of bleeding and difficulty in clot formation. This can cause a severe form of dengue fever called dengue hemorrhagic fever, severe dengue, or dengue shock syndrome. When the symptoms and complications mentioned above occur, it can indicate the development of a severe form of dengue fever. This severe form may be referred to as dengue hemorrhagic fever, severe dengue, or dengue shock syndrome. These conditions require immediate medical attention and can be life-threatening if not managed properly or promptly. Signs and symptoms of dengue hemorrhagic fever or severe dengue, a life-threatening emergency, include severe abdominal pain, persistent vomiting, bleeding from your gums or nose, blood in your urine, stool, or vomit, bleeding under the skin which might look like bruising, difficult or rapid breathing, cold or clammy skin, fatigue, irritability, or restlessness. Diagnosing dengue fever. Doctors can diagnose dengue infection with a blood test to check for the virus or antibodies. To diagnose dengue infection, doctors typically perform a blood test. This test can detect presence of dengue virus or the antibodies produced by the body in response to the infection. By analyzing the blood sample, healthcare professionals can confirm whether the dengue infection is the cause of the symptoms or not. Treatment for dengue fever. There is no specific medicine to treat dengue infection. Currently, there is no specific antiviral medication available to treat dengue infection directly. Treatment mainly focuses on managing the symptoms and providing supportive care to the patient. If you think you may have dengue fever, you should use pain relievers with acetaminophen and avoid medicines with aspirin, which could worsen bleeding. It is advised to consult with a healthcare professional such as your doctor for proper evaluation and guidance. How to protect yourself from dengue. Avoid densely populated residential areas where the risk of exposure to dengue carrying mosquitoes may be higher, can help reduce the chances of getting infected. It is advisable to use mosquito repellents to protect yourself from the mosquito bites even when indoors. Mosquitoes that transmit dengue can be present indoors, so applying repellents can provide additional protection. Wearing clothing that cover the arms, legs, and feet can act as a physical barrier against mosquito bites. Opt for long-sleeved shirts, long pants, and tuck your pants into socks to minimize exposed skin. When indoors, use air conditioning if available. Using air conditioning if available can help create a cooler environment and deter mosquitoes. Mosquitoes are less likely to thrive in a cooler temperature, reducing the risk of the bites and potential transmission of the dengue virus. Also, make sure window and door screens are secure and free of holes. If sleeping areas are not screened or air conditioned, use mosquito nets. To prevent mosquitoes from entering indoor spaces, ensure that window and door screens are intact and without any openings. In areas where screens or air conditioning are not available, Using mosquito nets during sleep can provide a physical barrier against mosquitoes. To reduce the mosquito population, get rid of the places where mosquitoes can breed. These include old tires, cans, or flower pots that collect rain. Regularly change water in outdoor bird baths and pet water dishes. The World Health Organization stresses that vaccine is not an effective tool on its own to reduce dengue fever in areas where the illness is common. Controlling the mosquito population and human exposure is still the most critical part of prevention efforts. So for now, if you are living or traveling in an area where dengue fever is known, the best way to avoid dengue fever is to avoid being bitten by the mosquitoes carrying the disease. Thank you for visiting our YouTube channel. We appreciate your support and taking time to engage with our content. Your presence means a lot to us. A big thank you for subscribing to our YouTube channel. We are thrilled to have you as a part of our community and we look forward to sharing more exciting videos with you.